Welcome to Plastica Review, where we're going to go through the latest papers on body contouring for the month of March. And the first paper is written by Achilles Tama from Canada and colleagues, and it deals with the gynecomastia classification for surgical management. They perform a systematic review of papers that deal with classification of gynecomastia, and they propose their own classification system. The paper is very well written, and it's definitely a very interesting topic. The classification they propose is based on breast weight, on skin redundancy, on the presence of fatty or glandular tissue, and they even mix in a little bit of another Canadian plastic surgeon, Paul Renault, and her classification of breastosis. So it's definitely a very extensive classification system, and although I believe that it does cover all the variables involved in a patient with gynecomastia, it might be a bit too extensive in the day-to-day practical use in terms of dealing with most of the patients with gynecomastia. But definitely a very, very well-written paper, and it's probably the most adequate classification system for a patient with gynecomastia at the present moment. The second paper on body contouring this month in PRS deals with calf augmentation. It's a multinational paper from authors from Serbia, UK, and Brazil. They review 134 patients, with 26 of these being revision cases. And again, they emphasize that these procedures can have very high patient satisfaction rates, and most of the bad results encountered are due to the lack of adequate implant sizes and shapes at the moment. Now, the next paper on body contouring is in ASJ, and it's a Swiss paper by Konstantinos Houretis and colleagues. It's a meta-analysis and systematic review of papers assessing seroma formation after abdominoplasty. It gathers the results of 9 studies, and they conclude that several factors may decrease the incidence of seroma formation after abdominoplasty, such as the conservation of scarpous fascia, the use of fibrin glue, and of course the use of progressive tension sutures. Now, I personally believe that one of the landmark papers in this regard is the publication by Patricio Andrades and colleagues, the group from Chile, where they showed very elegantly through imaging techniques that the use of progressive tension sutures, such as described by the Polak brothers or the Barudi sutures, really are helpful in avoiding a large seroma formation. And I also remember the excellent discussion of this paper by Samit Teoshia, the plastic surgeon from Dallas, where he made an analogy to the use of drains and progressive tension sutures to avoid seroma, with the use of suspenders and belts to avoid your pants from falling down. And he said that he would still use both progressive tension sutures and drains until a good prospective clinical trial was carried out. And the final paper on body surgery is an Australian publication by Gemma Sharp, who's a psychologist, and it studies the psychological benefits of labia minora reduction. It's a retrospective study on 48 women that had had the procedure performed, and the conclusions were that women were very satisfied with the results of their labiaplasty procedures, and they reported not only a satisfaction with the aesthetic result, but also of improvements in their psychological well-being and sexual function. The commentary on this paper is performed by Michael Goodman, who's a gynecologist practicing in California, and it is a very, very appropriate commentary. It criticizes the position of the American College of Obstetrics and Gynecology in regards to this type of surgery, where they haven't historically backed the benefits that these procedures bring to women that have the complaint of large labia minora. And I think they are both very worthwhile reads, both the paper and the commentary. And that's all for body contouring surgery in the month of March. I hope to see you all next month on Plastica Review. Thank you very much.